Can continuous bladder cancer surveillance cause anxiety? Can continuous bladder cancer surveillance cause anxiety? Yes, it can. Many patients with bladder cancer experience anxiety, especially those undergoing regular monitoring through procedures like cystoscopy. This is a common practice to check for cancer recurrence after initial treatment. Bladder cancer has a high rate of recurrence, which means patients often face frequent and long-term follow-ups. This ongoing monitoring can lead to significant psychological distress, including anxiety and worry about their health. The uncertainty of living with a cancer diagnosis can be overwhelming. Patients often fear that their cancer may return, and this fear can intensify as time goes on. Studies show that many bladder cancer patients report higher levels of anxiety, which may even increase during follow-up periods. The anxiety can stem from various factors, including concerns about test results, discomfort during procedures, and the overall emotional toll of living with a chronic illness. Several specific factors contribute to anxiety during continuous surveillance. First, the fear of cancer recurrence or progression can grow stronger over time, especially after treatment. Second, the physical discomfort or pain associated with surveillance procedures, like cystoscopy, can add to the stress. Third, the psychological burden of repeated medical visits and the anticipation of test outcomes can be daunting. Additionally, patients may experience postoperative complications, such as urinary symptoms, which can worsen emotional distress. Lastly, feeling uninvolved or uncertain about the surveillance process can lead to feelings of helplessness. Research indicates that bladder cancer patients have a higher prevalence of anxiety and depression compared to individuals without cancer. This psychological distress can be influenced by clinical factors, such as the stage of the tumor, as well as psychological factors, like feeling uninformed about their condition. The availability of social support also plays a crucial role in how patients cope with anxiety. In the case of squamous cell carcinoma of the bladder, which is a less common but aggressive subtype, patients also undergo similar surveillance. The psychological impacts can be just as significant due to the nature of cancer monitoring and the fear of recurrence. While continuous surveillance is vital for early detection of any recurrence and improving patient outcomes, it can indeed lead to anxiety. Healthcare providers should recognize this psychological burden and offer supportive care measures to help patients manage their anxiety. It is essential for patients to discuss their emotional concerns with their healthcare team to receive appropriate support and interventions. By addressing these feelings, patients can work towards maintaining their quality of life throughout the surveillance process.